I proposed this piece of legislation because I firsthand can understand the importance of palliative supportive care. There are many women across the state who have faced losing their child through a baby born prematurely or something happening during pregnancy. And I think it's very important and pretty easy to understand that the women need support and care in these situations from their family, from the community, from the doctors. And I understand, Representative, that you have an amendment to the bill to expand the bill to broader pediatric care. This bill is narrowly focused more on infant mortality. And so I am asking my members at this point in time to oppose the motion on a hearing. I think this supportive care is very easily understood. There is a wealth of information on supportive care for women on the internet, through various organizations. We just want to make sure that that information is distributed to women who find themselves in this type of circumstance. So therefore, I will be asking my members for a no vote. As the sponsor of the amendment, I had the language changed because I thought it was more a compassionate way to approach the bill. And when I looked at some of the wording, went to the internet and started looking at what other states are doing as far as this type of care, I thought this language actually better addressed my intent of what we were trying to do within the underlying bill. So thank you, members. This bill has nothing to do with abortion. This bill is providing care, supportive care for women who are choosing to carry their unborn child full term and then finding out either before or after the birth that that child has a terminal illness, and providing for supportive care for that woman. That is simply the parameters of this legislation to try to ensure that women, families who are facing this type of situation have the supportive care to deal with their grief, the process of grief, the process of death, and the finalities of that whole situation of bearing a child and then learning that that child is going to pass away and have a short lifespan. So that is the intent of this legislation. We've had a lot of advancements in technology. We are seeing our own Children's Hospital of Philadelphia doing many fetal surgeries, and obviously the hope is that those surgeries are successful. So as we see the advancement in technology, that's why we are looking at this definition. The bill, again, is addressing that compassionate care for women who want to have their child, but then are faced with a very life-threatening situation. That is the underlying bill. It is narrowly focused, and I again ask for my members to vote no on the Frankel Amendment. I think physicians are very free to talk to their patients freely about care. And I certainly do not believe that this piece of legislation stifles any conversations with a physician and their patient.